Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. I want to start off by saying Happy New Year. I'm excited to start the Roaring 20s, or what we in the health and wellness world call the Restorative 20s. But I'm truly manifesting a very different 30s from the 1930s because let's not repeat history. All right, this year I'm also very excited to announce my new practice, Mahan Health. Mahan literally translates to great in Sanskrit, and it just doesn't make sense to have anything but the absolute best when it comes to your health. So I will be seeing patients and clients in person in Columbus, Ohio, but I am also seeing clients and patients all over the world via telehealth. I love that we have this resource now, so people who don't have access to this medicine can now also have access virtually. So make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. All right, getting back to the podcast. As you know, and as I just stated, Mahan means great. And so that's why my goal for you listening or watching this podcast is that you're getting just a little bit closer to achieving Mahan or great health yourself. And this podcast is really all for you. So please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. Today's episode, I had the opportunity to interview an esteemed colleague and one of my favorite mentors, Dr. Ryan McNally. In this episode, we're talking about how to reverse aging. This is such a hot topic, so what I'm thinking is new year, younger you? I don't know, maybe. All right, Dr. McNally is the medical director of Aspire Regenerative as a state-of-the-art medical facility delivering integrative and technologically advanced medical care. He is responsible for leading and managing the vision of Aspire while developing and implementing the science, research, and technology. Dr. McNally also serves as a clinician holding 2 medical licenses in the state of California as a naturopathic doctor and a PA. In addition, he holds multiple certifications in regenerative medicine, aesthetics, and injection therapies. He is the former chief medical officer at Yale University, California, which is my alma mater, where he remains as an adjunct faculty member. In addition, he is also a faculty member at the Academy of Integrative Health and Medicine. He has held positions with the United Nations World Food Program and the Yale-Griffin Prevention Research Center. During his residency program, Dr. McNally trained under the distinguished physician David L. Katz of Yale University. Dr. McNally is a renowned and sought-after educator and speaker at conferences and universities and is often featured as a content expert in podcasts, articles, magazines, and is published in peer-reviewed professional journals. Needless to say, Dr. McNally is awesome and has quite the resume. He is, like I said, one of my mentors, one of my favorite professors from Bastyr, and I feel like I learned so much from him in terms of how to practice such evidence-based medicine and how to incorporate that into our worlds today. So I'm extremely grateful for the teachings that I've received from him, and I'm really excited for you all to hear from him as well. So make sure to leave comments below on what you thought of this episode and reach out to Dr. McNally or myself after the show. All right, enjoy. Hello, Dr. McNally. How are you doing today?
Good, thank you. Thank you for having me.
Of course. Thank you so much for joining me on my podcast. I really appreciate it.
Absolutely happy to be here.
Yes, great. Okay, so I ask all of my guests this question because I really love hearing everyone's story. So let's get right into it. What is your story and how did you get involved in natural medicine?
Yeah, sure. So, I think like everyone else, we have tremendous influences from our experiences growing up, and I'm no different. And so one of the things that inspired me or I grew up with was grandparents that had this huge garden in their backyard. And it didn't come from a place of them being interested in natural medicine, or it was just, or being hippies or anything like that. It was more along the lines of them just being pragmatic, folks that grew up during the Great Depression and were kids and kind of experienced scarcity. And so, one of the ways that they found that they could feed 6 kids throughout their lifespan was to have this huge garden in the backyard. And so, I grew up having, more zucchini than we knew what to do with, these big patches of strawberries, loads of broccoli and butternut squash. And it was just part of my upbringing. And so that was normal to me. And that's not the normal for everybody. And that's not everyone's experience.
Definitely.
And I would say another kind of big, profound impact on me was athletics. I grew up with a very sporty athletic background. I was always active, involved in town sports and so forth, and sports throughout high school, and then went on to college, and I ran track and field for the University of Massachusetts. So part of being healthy was also part of performance enhancement. So trying to be the healthiest I can to perform at the peak level and so forth. So that was a really big influence on my upbringing. And I'd say that probably the third piece for me that was really inspiring was when I was a young adult, I worked in, as like medical assistant and some of these early jobs, phlebotomy and so forth. And I saw these spirals where patients would go into the hospital with diabetes. They'd be stabilized and they'd go home, and then they'd be back into the hospital in 2 weeks with the same problem. And I thought, gosh, there's got to be a better way of doing this. There's got to be more out there. And so, you have these experiences throughout your life, and they really help to shape your future. And that's what it did for me.
Definitely. I love it. Okay, so how did you get involved in the anti-aging aspect of natural medicine?
Sure. Yeah. Actually, anti-aging is we'll start with, I hate the term anti-aging, right? Because, I think it conjures up, images of snake oil and, someone trying to sell you something that's, silly and so forth. And the reality is the quest of youth has been around since the days of Ponce de Leon looking for the fountain of youth, he never found it. He's dead. Spoiler alert there, but, the quest to be healthier for a longer period of time is still around, right? And the reality is we are now in a place with our research and our technology where we're starting to understand the aging process better. And we're starting to see that we are developing strategies that are viable and implementable to change the longevity process. So, so part of it is the development of innovation and research in science. And part of it is I got into it because, I'm trained in both conventional medicine and natural medicine. And so I know where we can get with conventional medicine. I know where we can get with natural medicine, and I know where we can get when we combine the two. And so, having years of experience of seeing what we can and cannot accomplish, you inevitably you see holes. You see areas where you can no longer make progress with this patient. And that's what drove me to take a really hard deep dive in regenerative medicine, is the desire and the pursuit to deliver better care and more to patients that were still suffering and still needed more care.
Yeah, definitely. I love that. And I love that you say that you don't like that term, because I also agree with that. I'm not a proponent of that term at all. Just because the reality, we're all going to age. We're all getting older. We're not getting any younger in reality, but it's about, for me, a lot of the ways I see it is like, it's about aging gracefully and painlessly. So not suffering while we age, because I feel like that's become a common theme amongst our culture, is like, oh, this is happening just because I'm getting older. I'm in pain or whatever. But there are other factors that play into it that lead to that pain and suffering. And I feel like that's what it's about. Yeah.
Absolutely. Okay. I agree.
Yeah. Okay, good. I'm glad we're on the same page with that. All right. So tell me more about regenerative medicine then. I feel like this is becoming extremely popular now, and people are seeking it out, but a lot of people still don't really know what it is. So what does regenerative medicine really mean?
Yeah. So if you don't mind, what I want to do to answer that question, because that's a huge question.
Huge.
Right?
Yeah.
And to answer it fully, I actually want to talk about the definition of disease and look at aging. And then regenerative medicine is essentially a tool to rejuvenate cells, right? So that's at a very, very basic level. What we're trying to do is rejuvenate healthy tissue. And by rejuvenating healthy tissue, you can then slow down the progression of aging or prolong the youthful function, essentially. And so, I've looked this up, probably 6 or 7 different sources, and they're all variations of the same thing. When I read this verbatim, this one's actually from dictionary.com. And so so the definition of a disease is a disorder of structure or function, especially one that produces specific signs or symptoms, or that affects a specific location that is not simply a direct result of physical injury. And so if you break that down and you ask the question, is aging a disease? Is it a disorder of structure or function? Well, at a very basic cellular level, we now understand what the aging process is doing. We understand the footprint that the aging process makes. At a very basic level, it's our own internal combustion. It's our own internal energy production, creating ATP from food, and then the byproducts of that are causing these cells to age. And when cells age, tissue ages, and then you get clinical symptoms and you get clinical manifestations. And we all know what they look like, right? We all know what aging looks like. If you picture what does an aged person look like, it's a specific set of signs and symptoms, right? It's wrinkly skin, it's thin skin thinning, it's skin spots, it's muscle thinning, and so that's part of the reason why when the skin ages, you see it almost looks like it hangs a little bit on the face. It's not just because of the thinnest skin, it's also because the muscle underneath is the scaffolding, and that has become smaller, and the adipose tissue, the fat tissue, has decreased, and so it tends to hang a little bit. So we see the physical manifestations. We also see it in the way people walk and move, right? The mobility. Nobody likes to become less mobile over time and be able to do less. And so, muscle weakness and osteoporosis and likelihood of fracture and joint pain and aches, less flexibility, all those are physical manifestations. And so when you actually break down the definition of aging, of disease, that's at least in my opinion, a strong argument that aging actually fits the definition of disease. And I think for most people, they probably never thought about it like that. They just think, oh, it's just a thing that everyone experiences and it's going to happen to everybody and so forth. And I can't argue that it won't happen to everybody, but I can argue that we probably should think about it as a disease, and there's stuff that we can do. So now let me tie that into, regenerative medicine, because you asked me a question about regenerative medicine, right?
Well, real quick, I have a question for you in terms of that with what you just said. Yeah. Would you say that cellular aging is similar to or the same as degeneration in general, or different completely?
I'd say it's the same. It's the same thing. In other words, the cellular breakdown, the byproducts. Again, I think the car is the best analogy because we can all see exhaust coming out of a tailpipe of a car. That's the byproduct of gasoline burning, right? Or use of gasoline as energy. Well, we don't use gasoline, but we use food. That's our energy source. And there is a byproduct from breaking down food, no matter what food it is. Doesn't matter if it's perfect food or really lousy food, there's still byproduct. And those byproducts are destroying, causing mutations in our DNA and our nucleus. They're causing DNA in our mitochondria, mutations in our mitochondria. They're causing senescent cells. So these are cells that are still alive, but they can no longer divide. And they essentially secrete chemicals and make other healthy cells around them sick. And so that's another part of the cellular aging process. Stem cells, as we age, stem cells become less able to populate, to regenerate, to make more stem cells, which is exactly what their job is. And so when you start to lose these things over time, you are essentially creating that footprint that I talked about for aging. So it's actually a definable entity. And that's new. That's over the last 10, 15 years. That's a new thing. Historically, we could not explain that.
Got it. Okay. Thank you for explaining that.
Yeah, absolutely.
Continue. Okay. So you can continue with the question about regenerative medicine then.
Sure. So now we have a definition of disease. We have aging, at least in my opinion, meeting that definition. And so what can we do about it? And that's where regenerative medicine comes in, right? Because the whole idea behind regenerative medicine is to reverse that cellular process. So at a cellular level, right, and we have thousands, millions of cells in the body, we want to try to basically counter each one of those components. We want to, I'll give you a really simple example. Hormones, right? As we age, our hormones decline. In women, we call that menopause, and in men, we call that andropause. It happens somewhere around the age of 50, some variation there. It's not new, but we replace hormones. And when you replace hormones, people typically feel better. There's, the symptoms of menopause and andropause tend to go away. But it doesn't reverse aging. It helps, but it's not the only thing. And it's because aging is very complex. And so, again, at a simple level, we are trying to regenerate tissue. We're trying to regenerate cells through various methods. One of them being hormone replacement, another one being through the application of stem cells. And that's what you're starting to see. And when you clinical practices like my own, regenerative medicine, is you're seeing the application of products that are like stem cells, that are not exactly stem cells, but are doing the same thing at a biological level. And you have other clinics that are actually using stem cells. There's a lot in the market. It's expanding and changing monthly. And that's why it's really important to stay on the research, because it's just evolving quickly.
Very, very quickly. And so could you actually go into a little bit on stem cell therapy? Like what exactly is that? I mean, I feel like, again, that's another one of those buzzword sort of therapies, and people don't really know what it is. So what are you really doing whenever you're getting some stem cell therapy?
Sure. And so this is another thing that has changed quite a bit over the years is, originally people thought, okay, you're going to get stem cells and you're going to inject me with them. And the stem cells are going to go into my body, and they're going to grow new tissue. And so you can imagine that when we tagged these stem cells and watched them over time, when they started dying within a week or two, we were very surprised because we saw clinical benefits, but the stem cells weren't turning into new tissue. So we were very confused as to, well, why are they dying? And how are we getting a clinical benefit if the stem cells that we just injected are dying within a few weeks? And so we started to realize it's not the stem cell. It's what the stem cell is doing to the tissue around it. It's all of the chemicals that it's secreting to regrow tissue. And so while the stem cell dies, it has already secreted all of these chemicals, growth factors, to make your own stem cells come in and to regrow tissue from your own stem cells, which is perfect because you've already got the tools to do that. You just need to kind of sound the alarm or wave the flag and tell your system that we need to regrow here. And so really what we're finding is that putting stem cells in a person is kind of a way of signaling the body to regrow tissue in a certain area and so forth. And so one of the applications that we have is we can take stem cells out of our own bone marrow. So what they'll do is they'll do a bone marrow harvest from your own pelvis, and then they'll put it through a process and concentrate the mesenchymal stem cells, which is a big word, but all it really means is they're stem cells that can turn into bone, fat, cartilage, and muscle, basically structural components. Okay, whereas other stem cells can turn to everything, right?
Okay, yeah, definitely.
So, and we call the other ones pluripotent, meaning that they can turn into basically any kind of tissue.
Okay.
But the ones that you're getting from your bone marrow are the ones that turn into those 4 that I just named. Okay. And so they'll take that and then they'll inject that into a joint, or they'll inject it around a joint for regeneration. But we've also found that there's another agent that's a little, the downside of that, of course, is you have to harvest it. You got to go in, it's an invasive procedure. You're pulling up bone marrow from yourself, and while they do it in an area that's fairly easy, it's still invasive, right?
Right.
You can harvest your own.
Right.
Yeah, absolutely. I mean, they make it comfortable. It's, okay. on a grand scale, it's not that bad, but it is still invasive and it's still intimidating to people as well.
Definitely.
Now, PRP, platelet-rich plasma, is basically a way of harvesting your own platelets, right? And so that's much easier to get because you don't need to drill into bone marrow. And so you can get that by just simply taking out blood from somebody and putting it through a processing system, and you isolate the platelets, which contain growth factors. And these growth factors largely do the same thing. And in some cases, PRP outperforms bone marrow. In other cases, stem cells. In other cases, stem cells outperform PRP. So there are areas where you use one over the other, but the reality is they both work. And over time, we'll get a better understanding and feel for which ones do we use in which areas routinely and so forth. But everything is still evolving. Everything's still very new. So PRP is used, and so you inject this concentrated platelet into the patient. Nice thing is it's coming from your own body, just like the stem cells did. You don't have to worry about any sort of reaction to them for the most part. And you can signal to the body to come in, to regrow tissue, to relieve pain, decrease inflammation over time, and so forth. So that's what we're using for PRP. And PRP is a huge line of product. It's not just one thing. People think PRP means one thing, but the reality is you can tailor your PRP. You can make it low concentration, high concentration, medium concentration. You can have red blood cells in there, no red blood cells in there to make it more or less anti-inflammatory, and so forth. And so there's different ways that you can kind of augment it. So it's not just one thing. And then we also have products that are derived from fetal tissues. So those are all like the cord bloods and the perinatal fluid and so forth, and the tissue, Wharton's jelly, and stem cells derived from tissue, and so placental, placental tissue and so forth. So there's a lot of products that you can derive from there, but the challenges there are you have to be able to take those products, freeze them, and then deliver them to a clinic that can administer them. And so you lose cells in that process. So when you freeze something and thaw something, cells oftentimes die. And so there's been some real challenges around producing a product that you can use in that manner and so forth. And there's still a tremendous amount of research that needs to go into that component of the industry to really determine what those are capable of and what they're not. Are the stem cells surviving? Are they not surviving? And so forth. So that's a big area. But I will say the one kind of promising thing coming out of that area is something called an exosome. And I'd be willing to bet that most people listening to this have never heard of an exosome.
Yeah, so let's talk about that a little bit.
Really quickly, let's talk about that. So an exosome is basically a little tiny particle. It's basically a bag surrounded by lipids or fat, right? And so the benefit of that is it's not a cell. And so if you stick that little particle in somebody, you won't react to it because it doesn't have the same structure that's on the outside of a cell that would make me react to somebody else's blood or tissue, right? It won't treat it like a foreign invader. So exosomes have a way of not reacting in that way, which inherently creates safety, which is a good thing. Right? We don't want to try to help somebody and then by accident cause graft versus host disease or an anaphylactic reaction or something like that. And so that's one way to kind of ensure safety. And then the other thing is within these little bags, essentially, these exosomes contain things like messenger RNA and proteins, and these are all of the growth factors that the stem cells secrete themselves, right? Because ultimately they're coming from tissue that was growing fetus, a baby, right? And so we know that the secreted factors are really good at growing. That's basically what their job was doing for the past 9 months, right? So we collect those, process them, make sure they're free of contaminants, make sure they're free of viruses. They concentrate them into a vial and they freeze them, and then they are then usable in a clinical office. And so this is kind of a new thing in the industry. There's still a tremendous amount of research that needs to go into it so we can really understand what we can and can't do with it. But it's very, very promising. Okay.
Yeah, that's really cool.
As you can tell, I'm very excited about it.
Yeah, no, I can definitely see your excitement. And I mean, this is so cool because this is definitely a field that, like I said, is growing, and even I'm still learning a lot about. So I feel like I'm learning a lot from you, and this is really exciting.
Absolutely. Yeah.
Okay. So when it comes to a lot of these therapies, what are common conditions that maybe you would use PRP versus stem cell versus the exosomal type of stem cell, the bone marrow stem cell versus the exosomal? What would be commonly used, or what would they be?
Absolutely. Yeah, that's a great.
For? Yeah.
Great question. Yeah, and to some degree, where I'm answering this with the best of our current knowledge, right?
Right.
This will continue to evolve, but as far as we know right now, where most of it has been used is actually like PRP grew out of orthopedic surgery. Like that's where they originally found PRP. So it was the surgeons who were using it and putting a little bit of the platelets into surgical procedures and found that, hey, it actually grew, it healed better, and so forth. So that's where we found out that it could help heal things. And so PRP is largely being used in two areas, although it's starting to expand a bit. It's going to be orthopedics, so things like into joints, into injured ligaments, around a joint capsule and so forth. There's been some research into muscles, so it's largely kind of skeletal, musculoskeletal system is where it's been used, pain relief and so forth. The other area where it's been used is skin, so it can be injected into the skin as a filler. It does promote angiogenesis, so that's the growth of new blood vessels. And so when you're trying to heal skin, that's a really great thing, right? You want more blood flow, you want to bring more nutrients and oxygen into the area, so helping to grow more blood vessels is a really great thing. So they're using it for hair regrowth, injection into the skin for fillers, reduce wrinkles and improve the texture of the skin. And hair is the other kind of the big one, like I said a second ago.
Yeah.
And
I want to mention real quick, for those of you who are listening or watching, PRP facials have become really popular, and those are like the vampire facials. That's the layman's term for the PRP.
Yes.
Facials.
Yes, you'll see horrendous pictures on the internet if you search that term.
Yeah, it's not, it doesn't look great that way, but I mean, this is why so many, celebrities and everyone are starting to use it because of the amazing benefits for skin regeneration.
Yeah, you just have to go to reputable folks, go to people who know what they're doing, go to people who have been doing it for a while, because, when things become trendy, sometimes people jump into it before they know what they're doing and so forth. And so just go to somebody, if you're going to go to somebody, go to someone who knows what they've been doing it for a while.
Exactly. Make sure they're a qualified healthcare practitioner who's been trained in this specific field.
Right. The first thing we got to do is keep you safe. That's the very first thing we have to do as a practitioner.
Yes, definitely. Please. Okay. Sorry. Continue. What are the other therapies?
So there's PRP. I'd say for the most part, the mesenchymal stem cells that you're getting from, that you're concentrating from bone marrow, largely being used for the same thing, more orthopedic stuff, not so much for skin, but definitely orthopedic. And then the exosomes, we're not, that's probably, since it's kind of the new guy on the block, we don't know the potential yet, but I'd say that the areas that it's being we're starting to collect data on, and what limited research we have is they are using it musculoskeletal. It tends to have an anti-inflammatory effect. So anything that's potentially inflamed in the musculoskeletal system could potentially benefit from it. I know some companies are looking at it for use for lung conditions and conditions of organs and so forth. And so because it has potentially multiple administration routes. And then the company that originally came up with the way to kind of harvest and perfected the formula on it, they started using it topically for a burn patient and so forth.
Oh, yes.
And so there's some evidence there that topical application for wound healing is going to be really helpful because of those growth factors that help with angiogenesis, blood vessel regeneration. So, it's very early, and I even hesitate to I don't want to make any claims yet, but there are. I can tell you that there are a lot of different areas that have been explored, but definitely orthopedic and skin are the kind of the two areas that we are routinely seeing.
Definitely. And I feel like there's a lot of potential in there for that too. Just like you said,
Absolutely.
Like there's of course still more research that needs to be done to confirm a lot of these things, but there's a lot of potential for these.
I know some physicians that are actually using it. They believe that it holds promise to have a, I'm going to use the term anti-aging therapy. So they're using it on themselves kind of routinely and with the hope that it will help prevent or slow the aging process. And so we can't claim that yet because we don't know, but we can, based on the science and based on what we think it's doing, there's definitely biological rationale for it.
Mm-hmm. Yeah, and it definitely makes a lot of sense in that. In terms of that, but yeah, unfortunately, we haven't seen someone go through the aging process yet and actually see if that
No, it's hard to do. It's hard to study that, right? It's a long study.
That's like 100-year study.
Exactly.
But okay, so I do want to go into this a little bit. So conventionally, just because we talk about a lot of orthopedic benefits of using these therapies, a lot of times steroid shots are most commonly used in the conventional world. And so how would you say the steroid shot would compare to these therapies? I mean, we already talked about what the way these therapies work, but can you explain a little bit of the difference here?
Sure, absolutely. Yeah. I mean, and so corticosteroids have been around for it seems like forever. I mean, 40 plus years or so. And that's kind of your mainstay in terms of if you go into, an orthopedic doctor and you have some sort of inflammation or joint pain, and that's what they're generally going to use. And the reason why they're going to do that is because, one, it's cheap. I mean, it's very inexpensive to give someone that injection. And two, you get a lot of bang for your buck. It's pragmatic. It's inexpensive and it tends to help with pain. But the downside of that is that it tends to cause tissue destruction over time. And so what we're finding is it's a trade-off. Yes, it's cheap, and yes, it generally does help. Not always, but I'd say the success rate is pretty good overall. But you're trading off that, pain reduces, but you're gradually making the underlying condition worse over time because it does destroy cartilage, it does wear down joint, and depending on how much you're getting, it can have other side effects as well. So there are still a lot of practices out there that are just using it purely because it's been around and considered safe for a long time. But there are a lot of new doctors coming in that are, saying, well, look, the evidence is there. We know it's destroying joint tissue. So this is not a good thing to use. And that's really where I've moved, is largely I will not do cortisone injections. I don't want to say never. There's always a situation that, warrants a little bit of everything. But overall, I think you're going to do more harm.
Okay. Sorry, I'm not sure what that is.
I can't hear anything on my end.
Okay.
Yeah.
Okay. So, thank you so much for explaining that. That really helps. So it is kind of interesting how the steroids actually lead to a little bit more degeneration, which is what the exact opposite of what these therapies that we're talking about are doing is with regenerating cells.
Exactly. Yeah, it's literally the opposite of what we want to do.
Yeah, definitely. And like you said, like it can definitely help with masking the pain, especially if the pain is so severe, and it can definitely help with that. But it's really important, as as naturopathic doctors, we always work to get to the underlying cause and really get to that part of it instead of just masking that pain.
Absolutely.
Yeah. Okay. Well, thank you so much for answering all those questions. And now, before we get to the rapid fire questions, I just have one more question. If there's anything else that you'd like to share in terms of anti-aging or aging gracefully and painlessly, as we like to put it, or if you have any other things that you'd like to share, resources, please do that right now.
Okay, great. So one of the things that, as I've had discussions with people about the process of aging, they said, well, how long, what is your evidence that a human being maybe could live longer than we currently are, or you could increase the health span, meaning the number of healthy years, right? And I said, yeah, that's a great question. So I did what any researcher and scientist would do, is I collected that information and I have it. So the oldest human being that we are aware of, assuming that the information, we believe this information is correct, but when it goes back 122 years, there was some question about whether this patient actually lived this long. But her name is Jean Calment. She is French, and I might have butchered her name a little bit, so forgive me. But she lived to 122 years and 164 days, which is pretty remarkable. And even if that is not 100% accurate, the runners up are right around 120, 119, and so forth. So, so we use this as the human being that we know that have lived longest. And if that is actually not correct, it's right around there. But if you look at the animal kingdom at large, and you're looking for evidence of, what does longevity look like all over, I'll give you a couple examples here. African elephant, which is this huge animal, right, can live up to 70 years. The macaw can live up to 80 years. The long-finned eel can live up to 106 years. The Galapagos giant tortoise can live up to 152 years. The bowhead whale and the red sea urchin can both live up to 200 years. The koi fish can live up to 226 years. The Greenland shark can live up to 400 years. The ocean quahog can live up to 507 years. And last but not least, I save the best for last, is there's something called the immortal jellyfish, which sounds fictional, but there's actually an organism that is biologically immortal. And so what happens is this little jellyfish, when it is threatened, it pulls a Benjamin Button. It will be an adult jellyfish, and it will reverse in age. It will become a polyp. It'll sink down to the bottom of the water and become juvenile again. And it can repeat this process over and over and over again because it has these regenerative qualities. And so it can still die. So if you took the jellyfish and crushed it in your hand, it would die, But biologically, it can regenerate itself and become old and young over and over and over again, which is absolutely remarkable. I mean, you have a living organism that is alive right now, which is a model for regenerative medicine. And it's not the only one out there, right? We know that things like starfish can lose a limb and can regrow it. Right? A salamander or a newt can lose a leg and regrow it. Lizards can lose a tail and regrow it. So there's a lot of small organisms that have these regenerative qualities that we can't. Now, human beings can't. We know that if we cut off someone's arm, it's not growing back, right? And we think that somewhere along the line, because we're big organisms and there's a big investment into keeping these regenerative cells around, that we had to make a trade-off, right? We had to make an energy trade-off. Otherwise, it could have kind of caused a system malfunction. It would have required too much energy to maintain ourselves to be able to retain the ability to naturally regenerate your arm if you were to lose it. And so it didn't make sense for big organisms to retain that, but small organisms, it did make sense because it allowed them to escape and to pass on their genes and so forth. So that's just Darwinism there, just kind of your basic survival of the fittest, right?
Yeah.
But absolutely phenomenal. Interestingly, natural organisms around us are demonstrating in our biological models for old age.
Yes. Oh, that is so fascinating. Thank you so much for sharing that.
Yeah, absolutely.
Yeah, that's really cool. Okay, let's get into the rapid fire questions.
Right.
So they're rapid fire questions just because they're the quick same ones that I ask all of my guests. However, you don't have to respond rapidly. You can respond as you please. Okay, so we talked a little bit about Mahon Health and how Mahon translates to great. So what does Mahon Health mean to you?
So I actually didn't know that. So thank you for teaching me something today. So when I think of the word great or Mahon, I think of aspiring to the best version of you. I think we all are at a different place. And it's not, it's very hard to judge, greatness or success with one person and apply that to everybody. But I think we all inherently have our own best version of ourselves. And I think that's what it means to me. Mahon would be aspiring to the best version of myself. And then hopefully I'm helping patients to do the same thing.
Yes, I love it. Thank you. Okay, and then the next two questions, they could be related or they could be completely different. It really depends on you. So what was the most difficult health change for you to make personally, and what are you still working on?
Okay, so, all right, you put me on the spot here, huh? All right, the hardest health change for me, I would say, I am a very busy professional. I've got a young family, and I think the hardest thing for me is finding me time and as part of that, finding time to exercise routinely. I go through spurts where I'm really good with exercise and spurts where I'm really bad with exercise. And eating well for me is fairly easy. I think that's the easy part, at least for me. But always finding that time for me to de-stress and relax. I feel like sometimes on a day-to-day basis, that's literally just sleep, Yeah. So it's my challenge, and it has at times been something that I've overcome, and always a work in progress. So always a thing I'm working on. So I would answer both questions with the same thing.
Okay. Yeah. So I'm going to prescribe some self-care for you there.
Thank you. I appreciate that.
Okay. Well, I feel like that's something that a lot of us can work on is our me time. So thank you so much for sharing that.
Sure.
And I mean, I hope like the reason why I asked that is because I feel like a lot of our listeners and they see us and they're like, oh, they have it all figured out. But I feel like bringing that vulnerability really helps to make us a little bit more relatable. And I appreciate you sharing.
Yeah, we may be experts and have a lot of knowledge, but we still are human and struggle with the same basic human challenges that everyone else does.
Definitely. Exactly. Okay. And then the last question I ask is if you could have a commercial, like a public service announcement, and it was on health, what would it be about and why? The reason why I asked this question is because I've looked into how much it would cost to have a commercial. And I've seen multiple commercials on pharmaceuticals and junk food, and that's influencing our healthcare system significantly. And so then I decided, I was like, what if we had a natural medicine commercial? It is way too expensive. So on a national level, it costs like $150,000 for like the worst timing of a commercial.
You just need a really good donor.
Yeah. And so I asked him, so I'm like, okay, so if we could all have commercials, what would it be about? So what would your commercial be about?
All right. I think I would say be proactive and invest in your health, both present and future, because the reality is we oftentimes wait until things are severe or it's too far down the line. And while there's never no hope and there's always something that you can do to improve, the longer something goes on, the longer something has been present, the harder it is to treat. You just can't make as much progress. So if we were to invest more in ourselves and in our health at an earlier age, and think about trying to maintain the trajectory of, I'd say right around the 40s is when things start to change significantly in terms of aging. And it's mild, but it's still there. Then it starts to speed up each decade after that. And so if we were to invest in our 40s, and younger, it doesn't have to be 40, you don't have to wait till 40, invest younger than that, then we can maintain potentially that trajectory of youth into our 50s, 60s, and onward. And who knows what the ceiling is, but I really do. I think if we invest more into ourselves, it will really pay dividends.
Yes. I 100% agree. I love that. Okay. All right. So that's all the questions I have for you. Where can people find you if they're looking for you?
Sure. Most of the time I'm in San Diego. It's my home. But I have a website. It's called aspireregenerativehealth.com. And I think you're gonna post that so people can look it up. And there's a ton of information on there, and we're always adding new information on there. So part of my website obviously advertises what I do in my clinical services, but it's also a site where people can use as information, articles and blogs. And I really wanted to make my website a place where people can go for good, reliable information about what is out there, because part of the challenge of regenerative medicine and so forth is trying to get the message out there that there is a lot of stuff out there that people don't realize they could do. I've got a phone number, email. You'll have all of that that you can post. Yeah, and so people don't hesitate to reach out, ask questions, and check out the website.
Yes, definitely. Fully embodying docere or doctor as teacher. I feel like, that's a huge part of it. And that's really cool that you have so many resources for people to get that education or information on what all these new therapies are, and proper information, right? There's a lot of misinformation out there. So,
yeah, that is so true.
Unfortunately. Yeah. So this is a good place for you all to go if you would like to learn more about these therapies and get legitimate research and legitimate sources of what these therapies really are and what they do.
Absolutely. Everything I do comes directly from the researchers. So I'm generally not the one doing research. I do a little bit, but I scoop up all the research coming directly from the folks in laboratories, the folks doing clinical trials. All that stuff is funneled to me. I go out and find it, and it's not funneled to me. I go out and find it, and then I use that in my clinical care, and I post as much as possible to the general public.
Yes, and I did mention earlier to the listeners that you were my professor, and so you're the one who really, I wanted to let everyone know that you're the one who really instilled this evidence-based, research-focused drive within me as well. So I'm very appreciative for you for doing that as well. Thank you.
It was my pleasure.
Yes, I love it. Okay, well, thank you so much for joining me, and hopefully we'll have you again soon.
Fabulous. I'd love to.
All right.
I hope you all enjoyed that episode and were able to understand that aging is inevitable. We are getting older every day, every minute. I mean, from the time you started listening to this podcast till now, you've aged. However, we don't have to suffer and we can age gracefully. And that's the message that I'd like you to get from this episode. All right, well, I will have Dr. McNally's information and the resources in the show notes below, so make sure to check that out. And that's all I got for you all today. Wishing you all Mahan or great health, and I will see you next time.